Dr. Jenna Lambeth here to talk to you today about one of the most common complaints that I see in my clinic, low back pain. I'm double board certified in anesthesiology and pain management, and I practice in an outpatient pain clinic in Belmont, North Carolina. I'm part of a group called Southeast Pain and Spine Care. So I spend most of my day seeing patients in my clinic that have various pain complaints, and I do injections or procedures to try to help them with their pain. So one of the most common things that I see on a day-to-day basis is low back pain. And some of these patients have had pain for 5, 10, 15, or even longer years. They usually tell me that their pain's worse in the morning or when they're trying to be active, like cutting their grass or lifting things at home. And when I hear that story, I'm always thinking, could this be related to arthritis? That's a really common cause. So I'll get an x-ray or an MRI, and I can typically see arthritis in something called the facet joint. So I've got a model here to show you what that looks like. So you can see here, this is a spinal canal. These are the nerves coming through the lumbar spine, or the spine in the low back. And at each level, there's a little nerve that comes off here. In between each level, there's a joint called your facet joint here. So it has cartilage in it that helps cushion it, and you use that joint when you bend or twist or when you lean over to pick something up. As you get older, you get wear and tear in that joint. So the cartilage starts to degenerate and it becomes painful. So that joint has a nerve that comes down here and a nerve that comes up here to send signals to tell your brain that it's hurting. What I do is I go in under x-ray and I put a needle here beside the nerve and put numbing medicine around the nerve. That numbs up that particular nerve for somewhere between 2 to 6 hours. So what I want to see is that you're able to go home during those 2 to 6 hours and it's easier for you to be active. Your pain in your low back is better, or maybe even potentially almost completely gone. If you do get success with that temporary block, then the next time I put a needle here beside the nerve, numb up that nerve, and then heat up or deactivate the nerve. When I do that, usually the nerve is going to be deactivated for 6 to 12 months. So you should get pain relief for that 6 to 12 month period. The nerve is tiny. It will slowly grow back together so it can send pain signals again. So the procedure would potentially need to be repeated in the future. But during that 6 to 12 month time frame, it would be a lot easier for you to be active, to do things at home, to lift things if you need to do that.